Edutainment Studios and Access Healthcare welcome you to Bladder Cancer Treatment Guide. This module is part 5 of a 7-part series on bladder cancer. Bladder cancer is one of the most common cancers, affecting approximately 68,000 adults in the United States each year. Bladder cancer occurs in men more frequently than it does in women and usually affects older adults, though it can happen at any age. Although it's most common in the bladder, this same type of cancer can occur in other parts of the urinary tract drainage system. About 7 out of every 10 bladder cancers diagnosed start out at an early stage, when bladder cancer is highly treatable. However, even early-stage bladder cancer may recur in the bladder. For this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for bladder cancer that recurs or advances to a higher stage. In this course, the objective is to help you know what are the side effects of bladder cancer. The side effects you may experience will depend on the type of treatment or treatments you have. Some side effects are temporary, while others are permanent. Some side effects can even happen months or years after your treatment. This is why it is important to talk to your doctor about all possible side effects before you decide on a treatment plan. Some of the most common side effects for bladder cancer treatments are fatigue, urinary symptoms like blood in your urine or painful urination, diarrhea, loss of appetite and weight loss, and/or infections. When it comes to managing side effects, remember to work with your doctor to help relieve them. Your doctor may be able to change your treatment, try a different dose, or prescribe medication to help. Learn all you can about how to help ease side effects. Start by asking your doctor. Ask your doctor if there are any side effects that could be severe, and know when you need to seek immediate medical care. Do not stop your treatment or suffer in silence because of side effects. Tell your doctor. Simple self-care steps may help ease some side effects. For fatigue, you need to plan to rest by taking short naps a few times a day. You should talk to your doctor if you have trouble sleeping at night. Try and stay active. Walking can help. Try to let others help you do chores or run errands so you can save your energy for things only you can do. With urinary tract symptoms, you should try to go to the bathroom as soon as you feel the urge. Take frequent showers, wear cotton underwear and loose-fitting pants. Make sure to drink plenty of water. You should aim for at least 8 cups each day. Try to avoid drinks that could irritate your bladder like coffee, alcohol, soft drinks, or any other drinks that have caffeine. You need to use a warm, not hot, heating pad on your lower stomach. If you should have diarrhea, make sure you drink plenty of fluids so you do not get dehydrated. Make sure to eat bland foods. You need to ask your doctor if it is safe to take an over-the-counter medicine. You need to make sure that you call your doctor if you do not feel better after a couple of days. Notice blood in stool, develop a fever, or lose weight rapidly. If your stool turns black or tarry, go to the emergency room. If you have a loss of appetite or weight loss, you should eat 6 smaller meals a day instead of 3 larger ones if you're not very hungry. Try to take a walk before you sit down to eat. You should increase your calories by adding milk, yogurt, or olive oil to your food. Make sure to get your calories however you can. Unless you have a health issue, eat whatever sounds good. If you have infections, you need to wash your hands well and often. If you need a catheter or nephrostomy tube, be sure you and anyone who will be caring for you learn how to keep it clean and sanitary. You need to stay away from crowded places and people who are sick. You should use a very soft toothbrush when brushing your teeth and be on the lookout for signs of an infection, like fever or discomfort. Call your doctor if you have them or notice new urinary symptoms. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 5 of this 7-part series on bladder cancer, and come back for part 6.